So, guys, I have one silly question. I don't know if it's silly or it's just stereotypical. Okay, so there's a belief that uh, there's a belief that men also have to play a role of preventing women from getting breast cancer. What do you think? It's another day. It's another episode on Vibes with Pets. Ladies and gents, it is the month of breast cancer awareness. Today on Vibes with Pet, we are having a special guest, Dr. Elma, who is going to be giving us a lot of vibe about breast cancer. And I want you guys to know that a lot of people don't read. Some people don't have access to the materials they need to be informed about breast cancer. So this video is just for you. Hi, Dr. Elma.
Hello, Pet. How are you?
I'm great. Nice to have you on Vibes with Pets.
Thank you
How
for
are you
inviting me
feeling?
here. I'm feeling fine.
Great.
For inviting me.
Yeah, so I'm having Dr. Emma here just for you guys. And after I have listened to her lecture, I couldn't resist getting to talk to her. So it's my pleasure bringing her right to your screens. Dr. Emma, can you say hello to?
Hello, guys.
Nice. So tell me, let's start from here. Why the choice of pink?
Pink, as you know, worldwide is the color, it's October color.
Yeah. Okay.
It's the color for advocating for breast cancer awareness. It's how we show support to those women who are affected with that disease.
All right. So
Yes.
pink is a choice for October and for breast cancer awareness. Yes. Okay. I just want to ask a question that I'm going to put like classify into A and B. Who are those who can get breast cancer? For example, do children like girls below the age of 10,
Okay.
can they or are they exposed to breast cancer? Because normally we know that breast cancer is for adults,
Yes.
or is it an infection only for women?
Okay. Thank you for your questions.
Mhm.
I'll start with the first question. Can
Yes.
children under the age of 10, young girl, get breast cancer?
Mhm.
Yes, those are rare occurrence,
Mhm.
but they can happen. As I mentioned during my presentation,
Yes.
it depends on the type of breast tissue they have.
Right.
Nowadays, we have younger girls, 8, 9, 10 years of age, who have dense breasts. If their breast is dense enough, they can be susceptible to
Okay.
develop breast cancer.
Right.
But other factors should also be involved. Maybe what they've been exposed to,
Mhm.
radiation, some type of medications. If they've been exposed to those chronically over so many years,
Okay.
they might uncommonly, develop
Yeah.
breast cancer. It's a
Yeah.
rare occurrence, but it
Yeah.
can happen.
Right.
It's very rare, but it can happen.
Right. So how about men?
Yes, men can also have breast cancer. We only focus on women, but 0.5 to 1% of men can be affected by breast cancer. So men should also make sure to do their self breast examination, just as women do.
Right. Thank you so much, Dr. Emma. I think we've got a lot to learn from this. So I did listen to your presentation. I must say it was splendid and we did learn a lot. So I just want you to tell the viewers on Vibes with Pet first, what are the things that women can do? I'm going to ask the questions that are not very obvious, right? What are the things that women can do in order to prevent the possibility of getting breast cancer?
Okay. Some of the things are having a healthy lifestyle. We can't emphasize about it. Try not to live a sedentary life, exercise, don't drink too much alcohol, try to quit smoking because those factors are really increasing your risk of developing any type of cancer in general. As a woman, sometimes we tend to also take some pills,
Yeah.
hormonal pills. Let's try to avoid them if they are not prescribed by a healthcare practitioner and if they are not necessary. You
Right.
understand?
Right.
So there are so many factors. Others could be exposure to radiation, although it's not so common, but you can be in a place where radiation happens to occur,
Yeah.
and unfortunately, you develop breast cancer. Also, what you eat. Be conscious about what you eat. Whenever you
Right.
go to the market, supermarket, check the labels, what's inside. Avoid processed
It's
food,
food.
canned food. Try
Okay.
to eat fresh food
Yeah.
that was produced that day, fresh
Okay.
meat,
Yeah.
fresh vegetables. That
Right.
would be the best choice for a woman to avoid the risk of developing breast cancer.
Thank you so much. I do appreciate that. So, by the way, the theme of this year's Breast Cancer Awareness Month is no woman should suffer from breast cancer alone. That means we should give them the support that they need. It doesn't mean we should go get it too. We should give them the support that they need. Okay, Dr. Emma, next to our next question, which is the most common way a woman can use to know that she is breast cancer free?
She's breast cancer free.
Yeah.
After her treatment, that will be, we talked about it, that will be surgery, chemotherapy, whatever, radiotherapy. We have a follow up.
Okay.
All right. We will still do the mammograms,
Yeah.
the ultrasounds, the MRI,
Yeah.
or the biopsy sometimes to make sure that there's no cancer cells left in your
Right.
body. Those are the safe ways to make sure that you no longer have breast cancer.
Yeah.
You understand? Yes.
So, guys, I'm not going to ask Dr. Emma this question, but I'm going to tell you myself to show you that I did learn during her presentation. So, what we do, if you do your self check on breast cancer by doing your massages, the different movements of the hand on the breast, you can go for your mammography
Yes.
checkup to be very sure that you are not having breast cancer. To the next question, which one of the participants did ask her, which I think is also important that you guys know, is this: is breast cancer genetic?
It has not in all cases, but
Mhm.
it can have a genetic incidence,
Right.
maybe some genes that you have or some family history. Some
Yes.
families, unfortunately, tend to have cancers and
Yes.
breast cancers in particular.
Yeah.
When something like that tends to happen, try to see a doctor. Tell them in advance that you have that in your family so that they can monitor you before and diagnose you early
Yeah.
so that you can improve your survival rate. You
All right.
understand?
Right. This is wonderful. So, guys, you're learning a lot from Dr. Emma. The next question, which I'm going to ask her, is this: some other question which was brought up during the presentation. Those are the questions which are not very obvious. Okay. Does I don't know if this actually happens nowadays, but if it does breast ironing expose a girl child to breast cancer?
Yes, breast ironing expose a girl's child to breast cancer.
Okay.
Suppose you expose the child to inflammation, Cancer, if you are somebody who is interested in it, one of the things is inflammation. How the cell will multiply, grow. If a cell multiply and grow without control,
Mhm.
it can lead to the formation of a tumor and
Yeah.
maybe cancer.
Yeah.
So when you have flesh that is wounded and that is not well taken care of,
Yeah.
inflammation can install. You
Okay.
understand?
Okay.
And the cells can divide abnormally,
Yeah.
leading to that.
Okay.
So it's better not to practice such custom
Yeah.
nowadays.
Yeah.
It's better to educate the woman and the young men about sexuality rather than to go to such extreme measures and risking a woman to lose her breast in the process. Okay.
Great. So thank you very much. And I know that you did mention something about this question. So I want to ask, I want to find out, do you think that a woman can be completely free from breast cancer after a treatment?
Yes, they have women who have showed complete remission
All right.
from breast cancer. It does happen, but you just have to fight. You just have to have the right medical care
Mhm.
team and support, the
Right.
right people around you, and you have to be willing,
Yes.
to get better.
Right.
Often it happens.
Right.
Okay.
Okay.
Yes.
Yeah, that's great. And the last but not the least question, the last but not the least question, guys, I just want to ask Dr. Emma, okay, if you have breast cancer, and I just want to ask, does it spread to other parts of the body? Can it spread to other parts of the body or it stays in the breast?
It does spread. It's what it's commonly called metastasis.
Right.
Any cancer, just like breast cancer, can metastasize, and it's the worst outcome we hope as medical practitioners.
Right.
Because once it's spread, it's even harder to control.
Right.
Okay. Usually you start from the breast, and that's why we encourage you when you do your self exam, even to check the armpits.
Yes.
Because we have a lot of arm lymph nodes around there,
Yeah.
and around your collarbone, which are the ways cancer cells prefer to travel.
Right.
So always, examine those parts and
So let's
yeah.
let's maybe practice one of those part, those the check that you did project. Like I didn't know that you had to go right to your underarm.
Yes,
Yeah, to your underarm. I just thought maybe the massage just takes place there. I didn't know you had to go right to the underarm. So guys, you need to check right to your underarm. Yeah, to be sure, not only around the breast. Yes.
Do it in circles from the outer part of your breast towards the nipple. Pinch your nipple, make sure there's no discharge, like blood or pus, something like that. You can also do it in wedges, from different parts, from the outer part towards the nipple, always. Also in lines, up to down, up to down. Never forget the armpits and the collarbones. Right.
So, guys, I have one silly question. I don't know if it's silly or it's just stereotypical. Okay, so there's a belief that uh, there's a belief that men also have to play a role of preventing women from getting breast cancer. What do you think?
It's a recurrent question. That and it's part of the intimate lives of couples, right?
Okay.
But that question comes because we encourage women to breastfeed, as you know.
Yes.
Breastfeeding is a decreasing risk for breast cancer. Sometimes such intimate things can happen in a couple's life.
Yes.
So a man doing that can only benefit sometimes to the women.
Okay.
You understand?
Okay.
We still need to do some more
Research about
scientifically, but it's part of the folklore.
Yeah, that's why I was saying that it might sound silly or stereotypical. Yes, thanks for clarifying about this one. So, guys, I don't know. I could ask her many, 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 and keep asking her more and more questions on your behalf. But I think there's a lot of material out there that we can read, we can research to get this. But like I said before, she's here for those of you who might have exposure to this material but have no time to read them. And for those of you who don't have exposure to read this material, I hope that this chat, this interview was beneficial to you. So thank you, Dr. Emma, for coming on Vibes with Pets.
Thank you for inviting me.
Yes, we hope to have you more and more for more educational talk.
I'm available.
Okay, ladies and gents, you've been watching Vibes with Pets. Thanks for being there. Thanks for staying tuned. And I will see you in my next episode.
Bye.
Bye.
To go and check what is happening. But I think we are exposed. It's good for us to go for a regular checkup, maybe once, twice a year, to know how your system is. Don't carry the mentality that we have back home that,
Yeah.
oh, me, I go to the hospital only when I'm critical, when things are really, really hard. Hospitals here are not that expensive like back home. So I think that's where